Hello and welcome to PM Personality Profile. My name is Nana Ansakwao the Fourth, and every Friday, come Saturday, I come to your house with a personality, somebody who has a story to tell. Now, my personality today, his father used to make sculptures. His mom was a local entrepreneur, a Makula woman. And what did he grow up to become? A cosmetic gynecologist, Dr. Kwasi Debra. Now, it's intriguing, it's amazing. You know, I really want to talk to him because I just want to find out what their whole world is about. I mean, I have a bit of a bulge and they suck some out. I have a bit of a flat back and they add some on. Is it safe? Is it even Ghanaian? I mean, are Ghanaians doing these things, and when did it all start? I am intrigued. We're back here at Alisa Hotel. We're going to sit by the poolside and I'm going to sit Doctor down. Find out a bit about his childhood, but mainly I just need to know what goes on in the cosmetic world. Stay tuned. Well, thank you very much for staying, and clearly you can see from my excitement. And every now and then I have a very selfish interview, you know, something that I am curious about and I want to find out how it is, and then you bump into a resource person and you think, well, there we go. I'm going to be inquisitive and find all I need to know by myself. But I'm sure there are many people. I mean, like before the interview started, my producer has asked for, you know, his quotation. Obviously, he's well above his price. Not because the procedure is expensive, but the part he wants to reduce is large. But as we go on, you'll find out. Folks, I'm here to talk to Dr. Kwasi Debra, who is an obstetrician, gynecologist, and also a cosmetic surgeon. I have always wondered, cosmetic surgery. Is it Ghanaian? Is it African? Indeed, is it West African? I mean, who gets up in the morning and says, I'm going to have my boobs enlarged or reduced, or my stomach enlarged or reduced? I mean, I'm due a six-pack. I don't know whether I'm going to work it out or liposuction it out, but this is going to be the nature. But I just want to find out who Doctor is. Dr. Kwasi Debra, thank you very much.
Oh, thank you, my brother.
And
how are you doing?
Very well. You can tell from my excitement, but we will get there. I want to just go all the way back to your childhood so that we all find out how you ended up as a, you know, cosmetic surgery. And let me learn your secret. When your name came up for the interview, we were told that you could change men to women and women to men, you know, so you should have seen the chat going on between the production team as to who was going to finish the interview, go back to the office as a man, and those who are going to go back as girls.
That's interesting. Very interesting.
But thankfully you don't do that.
No, I don't.
Okay, let's go back to your childhood. Grew up in Accra, grew up somewhere else?
Well, you know, I grew up actually starting from Silicone.
Okay.
Went to primary school in Silicone, Roman Catholic.
Okay.
And then later on came to Accra and went to school here they call Ring Road. Ring Road. Well, actually, I went to Kimbo Boys, and then we transferred to Ring Road School. Ring Road, which is across from plus 233.
Okay.
Yeah, on the yeah. So from there, I went to enhancement school, and then spent my whole 7 years at enhancement, and then went to medical school in Kwasi, School of Medical Sciences.
What was Kimbo like? Let's go back to Kimbo. I mean, was it like normal, or was it more rough, or what was Kimbo?
Oh, Kimbo was a school to be in, you know, because I mean, in those days, you know, the boys were the boys, you know. You know, nobody could touch any Kimbo boy.
I see.
Yes.
I see.
And you know, we were masters of our own domain, as it were. Yeah, and that's how it started. But I wasn't there for long, about 2 years, and then yeah, went to Ring Road. The Ring Road used to be called My Own Camp School. You know, I guess My Own Camp. I think I don't know why that name came about, but they called it My Own Camp. You know, that at that time then. I entered that school. I think I was there for about 2 years, and then I took the common entrance, and then went to enhancement.
I see. Parents, I mean, what were your parents like? Were they in the medical field as well?
No. In terms of medicine, I'm the real first generation doctor in my immediate family. I have uncles and cousins who are physicians, you know, or in a health care. But my father started as a teacher, and then he later on went to study art and sculpture at London School of Polytechnic. You know, so he had an eye for beauty and art.
Okay.
So he did a lot of sculpturing, you know, and
with what material? Wood or clay?
No, he would use clay.
Use clay.
Yeah, mostly clay. It was mostly clay. But we spent some pleasurable times with him when he would just sit you down and give you a portrait. You know, so I have some of that. You know, and then you know, when he came back from London, he, you know, now had, you know, became famous with his sculpturing, where he had sculptures all over the house. You know, he would, you know, that's what he taught in school. On the other hand, my mother was, you know, Makola woman, businesswoman. You know, she would trade in different things. Actually, she started out as a seamstress and then dropped that when we were all in school. That she would make all our clothes for us, you know, and then went on to do to become a trader, you know. So she had a place at Makola. And,
so Mom is an entrepreneur and Daddy's a sculptor.
Yes, you know, so what a combination.
Can we deduce that's where Doc is getting his, you know, business side and sculpting of people from?
I guess so.
You see, best of both worlds.
Absolutely.
I see. Yes. Did you help on the market, or were you?
Oh yes. No. Listen, I remember one time my mother had to undergo surgery for gallbladder. You know, so this was at Kolibu, and she obviously became. Those days they didn't do the pinhole surgeries. You know,
the chest to waist.
You can imagine.
You can imagine.
So basically, I was taking care of the shop for her. You know, I mean, folks who had bought stuff on credit, you know, will come back and bring the money, and I will be checking the money, counting, and you know, and the biggest challenge was, you know, when it was all over at the end of the day, how to hide the money so that you don't get these boys mugging me and pulling me over, you know. So that was the biggest challenge. But you know, we survived that. It was for a period, probably about 3 months, when she was incapacitated, you know, recovering from the surgery, and you know, so that was my experience. And all the ladies knew me, you know, who were around her shop. You know, they thought I did a good job.
May I be prejudiced and ask if Mom was a woman?
Yeah, both parents Kwa, you know. What can I say? What can I say?
I know they're very entrepreneurial.
Yes,
you know,
yes.
They have that spirit, that entrepreneurial spirit. Okay, both parents are Kwa.
Yes, they both are Kwa.
Okay.
Yeah.
Any siblings?
Yes, I have one sister and 7 brothers. You know, they're all in computer science, civil engineering, and you know, one or two of them entrepreneur business. You know, yeah. But I'm the only physician.
Yeah. Well, I must say that your parents did well, because it's a large family, and you managed to push everybody through school. Was Mom educated?
No, Mom wasn't formally educated. You know, she probably got up to you know, middle school, and you know, she just went off and did business. But my father, you know, he went to Achimoto school, you know, and he was very proud of it. Unfortunately, none of us boys went there. We went to different schools, you know, Prempes, Fansfilm, GSTS, you know, and the likes.
I see. Are you guys still in touch, or?
Oh yes, yes. We're all together. You know, some are here in Ghana, and some are the rest of them are in the States.
So from Fansipim, did you know you were going to be a doctor, or how did you end up in medical school? Was it the dream to say, look, this is what I'm going, or you stumbled on someone who said, no, try this and see?
You know, it's interesting. I did maths at A levels. Mm-hmm. So after my A levels, I got accepted to do computer science and statistics at University of Ghana. Mm-hmm. And then I got accepted to do building technology in Kwasi. Mm-hmm. So that was the dilemma for me. I was thinking maybe I'll become a statistician, or I'll become, what you call a building technologist and do project management. So it was during the long vacation when I met one of my, I would say he became my mentor at some point. He had finished ahead of me from France. I met him at a party, and we're just talking. This was the long vacation. He says, so what are you going to do? He says, oh, well, I got accepted to do this and that. And I asked him, so what are you doing? At that time, I think he had finished medical school. So we kept talking about it, and he says, with medicine, you probably could do a whole lot of different things with it, change your career path. I never really had thought about it that way. And I went back, thought about it some more, and I said, well, let me see what happens. So I went to Kumasi and then put in an application for medical school, and then I got accepted, and so that's the end of story. But these days, I mean, because at that time I think the grades were good enough, I could go wherever I wanted to go, but that's became the end of story, and I just didn't look back.
You see, I mean, I know we'll get there, but if I judge your passion now,
right,
you don't come across as somebody who just said, well, I'm going to try my luck. You come across somebody who said, no, I was born to be a doctor and I have to be a doctor. For the passion you have for the job now, that's what I would have expected you.
Well, probably I'm a late bloomer. Because I mean, growing up at school, doing math came much easier than spending time read the books. You learn the formula, you practice a couple of things, and say, okay, let it go and play. But if you have to read a whole lot of textbooks, really wasn't my thing. But some things you get adjusted, you get used to it, and eventually you love it. But
did medical school come easy for you? I mean, changing from maths, because now you have to start reading all these terms.
Well, medical school wasn't a problem, essentially because it was just understanding what everything was about, and then try to apply them. So that became the thought process, and that became the mode of moving through, medicine, rather than the old thing, you chew, you pour, and you forget, I mean, this was just understanding, there's a method to all the anatomy, there's a method to all the chemistry, there's a method to all the physics, and it's human beings. And when you visualize, I'm a visual person, so when you visualize stuff, it sticks, so it came, and you really have I mean, for me, I had an aha moment, really when I thought about medicine after the basic sciences, thought about medicine and said, boy, there is the creation of a human being and there also is the healing process, and it's just getting into that area became something that you know, I never really thought about it, but one day I woke up and I said, man, this is going to change my life, you know, because now you become a different person. You're more passionate about things. You can express, you can make things or heal people, and that becomes a humbling event, you know. So those are things that went through my mind over the years as I moved along, and that really was a clincher for me.
Well, stay tuned. We're going to come back, and then when we find out, so after you've gone through medical school, you become a general practitioner. Which other steps did the doctor go through to get to cosmetic surgery stage? Thank you very much for staying, and well, we are building up. We're building. I know you're waiting for it, just as I am. We're waiting for it. But look, you go through medical school, so you become like a general practitioner by now.
Yes.
And then now we need to work our way up to become when we start dissecting people and, you know, making them look better.
Well, you know, at this stage, you know, this was in Kwasi, newly minted doctor. Mm-hmm. You know, what do I know? Than to bask in the glory, you know, and enjoy. Well, I went through the rotation, typical housemanship at Confirmatory Teaching Hospital. Did my OB/GYN rotation, my surgical and medical rotations, and when it was all done, I actually had planned to go to the U.S. And so I took the qualifying exam to enter residency or training in the United States. And I passed that, and then went over to the U.S. And you know, took me about a year or so. Eventually, I got into residency at Howard University Hospital. And initially, I did a transitional year, which is a rotating internship, you know, from department to department, you know, just to get a flair of what's going on. Because, you know, the training in Ghana is strong in terms of the academics, but there's certain things that at that time because we had only read about in the textbooks, so it became more practical, and I just needed to get used to it. So in the long run, I started, you know, I did a transitional year of 2 years in internal medicine, and then I eventually did obstetrics and gynecology. And so after the obstetrics and gynecology training, I went to practice, you know, in Richmond, Virginia, for a couple of years. But I started thinking about, you know, what happens when you get older, or as you know, mature in healthcare. What do you do? Because, you know, in America, unlike in Ghana, the doctor is the one who catches the baby, you know, and you don't leave it for anybody, you know. But in Ghana, you know, you get the nurses to do the deliveries for you, and when it becomes complicated, then, you know, the doctor comes in. So so I thought about...
Well, in America, the doctor has to do that?
The doctor is the one who's doing the delivery.
Wow.
Yeah, the Americans believe in getting paid for what you do. You see what I'm saying? But it comes to it. I mean, yeah. And so I then enrolled, whilst I was in practice, I enrolled in business school at the College of William and Mary in Williamsburg. And I did an executive program.
In business school?
Yes, business school, yeah. So I did an MBA, you know, in executive MBA, College of William and Mary. So when I completed that, I started looking at options in terms of, you know, where I want to be, you know.
Well, let me take you back. I mean, because you practiced in Ghana, you know, you're schooling in Ghana. What would have been the difference? I mean, the level of training you get in Ghana, level of training you would have gotten in the US, on par, or?
The level of training in Ghana is, I don't know what it is now, but at the time it was very good.
Okay.
To the extent that you could pass the exam, you know, with ease, and you go there, all you need is an orientation as to how things are done, and then you just keep on going.
Okay.
You know, so they did a good job. Thank my professors, they did a good job giving us good training here. And so from that point on, I started looking at options. What do I want to do? Medical management, you know, do I want to go into pharmaceuticals? You know, like working with Pfizer or, you know, whatever. But I actually did part-time work with the Blue Cross and Blue Shield, where I was medical director for, you know, case management, you know, and it wasn't as fun as I thought it was going to be. And then I looked into pharmaceuticals. Then eventually I decided that it would be best to get into you know, hospital development as, you know, as a future. And so I put a group together, and we set up an outpatient surgical center that is called Forbes Ambulatory Surgical Center. So I put the team together and we set it up, and, you know, and we're still operating that right now. So what happens typically is that there's certain procedures that you can do on an outpatient.
Okay.
That is same-day surgery. You know, and there's certain procedures that you need to be put in the hospital. So if you're going to do a procedure that can be done at a same-day surgery, then we take you to this facility, we do the procedure, and then you go home. You know, and that becomes an easier process because, for one thing, the number of hospital beds get smaller and smaller. You know, so because of the population, relative to the population. So we're always trying to take as many patients, outpatient surgery, and then, you know, they go home. So after a couple of years, I started thinking about cosmetic surgery because one of my friends who did internal medicine, you know, went and acquired additional skills to do cosmetic surgery, and he's in New York. So he invited me. I went to look at his practice, and, you know, I went to just, it's like became a mentor for me. And we're doing liposuction, body sculpting, essentially. That's what it is. So with that knowledge, I did a formalized training with Jeffrey Klein. You know, he's in California. You know, he has a program that you go and, you know, they give you didactics, and then you you know, you gain experience from the lectures, but you still have to come back and practice on patients. But that practice usually involves, you know, working with another doctor to get experience. So after one becomes comfortable, then you can move ahead and take cases on your own.
I mean, from moving from gynecology to, you know, because 1 minute you happen to give birth, and now the next minute you're shaping the bodies. I mean, was it a huge step or was it a natural step?
It was easy in the sense that for me, doing my transitional year in the residency, I did a lot of general surgery. I did intensive care unit management of surgical intensive care unit. I did a rotation in the cardiac care unit, you know, where people have heart attacks, and we manage them. So with that combination, I became well versed in managing very, very sick patients.
Okay.
And I also did quite a rotation in an emergency room. So my background gave me enough experience to pretty much manage any complex situation. So with that kind of training and with the obstetrics, it became, I was at a point in my career that I had acquired enough experience to be comfortable with this. And when I started working with my friend doing some of the procedures, I think at that point the artistic part in me just started coming out. I was looking at things different because, you know, if you don't have the eye for the beauty and the eye for symmetry and the eye to look at stuff, it makes it very difficult for you to achieve what you need to achieve. Some of the stuff just comes natural, you know. So what had happened was, at some point in my career, I then decided to stop doing obstetrics on my own. I was just teaching obstetrics. So I'll teach the residents. And then when I quit obstetrics in my practice, I had a lot of time on my hands to be able to focus on the cosmetic surgery.
Okay, now let's talk about cosmetic surgery, because that's one of the main reasons why I was excited about this interview. You know, sucking things out and adding things on and sucking things. Let's start with you. Would you do anything to yourself? Would you suck something out or add something to yourself?
Well, you know, everybody has a beauty secret. I tell folks. Yeah, you know, and you know, typically.
Is there body parts you would change on yourself? If I was a cosmetic surgeon, would you come to me and say, well, Nana, you know, suck a bit out of my arm, or, you know, chin, or raise my jawbone, or?
Well, you know, as we all get older, the malar fat drops, you know, and then we begin to have these, we call them nasolabial folds, okay, and it makes you look your age, really. but along the line, we all want to stay youthful. You know, it's interesting that the human being, when you see someone with gray hair, they're not, you know, as they don't appear youthful as someone with all black hair, you know, that type of thing. So every now and then I give myself a little Botox and a little filler, you know, to smooth out the lines, you know, so I appear youthful, you know, and that's essentially some of the things that I do. Is it? I mean, do Ghanaians, you know, patronize your service? Oh yes, you should see the number of calls I get when I come here. You should see the number of people who are coming in for consultation. What are our main worries? And is it the same as in America, or they have different worries? I want to know what our worries are first. Well, interestingly, the number one worry in Ghana, believe it or not, is scars. People have scars all over their legs, and they want it taken care of. But I thought that was permanent. That's well, but you know, it's you see, it's the education. You know, it's the education. People, that's the number one worry. Some people say, look, they can't wear skirts, especially the ladies. They can't wear skirts anymore, and they would like these scars taken care of. Some people say, you know, it's disfiguring, it's low their self-esteem, and you know, that's the number one worry. And you know, I most of the time I tell them that, look, you can either get a skin graft or you can cover it up with, you know, we have some cover makeups that is matched to the skin color that we can use to cover it up, you know, and then you just, because some scars you can't do anything about. Some scars depend on the location. How about tribal marks? Could you take tribal marks out? You can take some you can't. You know, yeah, it depends on where it's location, how extensive it is, you know, and that's if it's too extensive, there's not much you can do about it, because the way they do the tribal marks, they actually put stuff in fire and heat it up and make it a cut, a deep cut, and so it actually cause severe scarring, you know, in this the tissue beneath the skin. Okay. So you have to really excise quite a bit of tissue to be able to get it. But you know, some can be done. But if it's multiple all over the face, not much we can do about it. Yeah. And then the second thing is a lot of people want flat tummy. Men, women, they want flat tummy. Then a lot of people want youthful breasts, you know, and then we come to the new A shape behind. You know, they call it the baby gut butt. You know, or Brazilian butt lift. You know, I mean, most
people come to you for that.
Yeah, yeah. Most African, you know, women have a good shape in their behind, but sometimes what happens is that because of poor dietary habits, they lose that shape. And most of the time, what we really do is to redistribute the fat, and that brings their shape back. Because structurally, everything looks good. We just need to take fat from the sides and the back, and now they have perfect shape. Every now and then, some women will have a low dimple or a low dip in the middle of their sides, and then we may have to put in some fat to get the curve.
If let's say I had liposuction, I mean, could I get the pot belly back, or that's a permanent solution?
Well, for men, if you keep drinking beer, the two areas of fat we're talking about. One is the fat just right under the skin. The one is fat that's inside the abdomen, right around the intestines. The fat around the intestines comes from poor eating habits. And that fat, when it comes in, gets pushed out and gives you your pot belly. If the fat is restricted to the area under the skin, yeah, we can take care of that, and you see your six-pack, you know. And once you have your six-pack visible and you work out, you can keep a lot of the protrusion or the push from the fat inside your belly, you know, so you can have a flat stomach.
Well, that's what I need. Mine is definitely under the skin, so you know, that's what I need. Now, when we come back, we want to find out, is it safe? Don't move.
All right.
Thank you very much for staying. And I'll tell you what, you want to be here when we call for a break. I'm telling you, we're talking about extensions, width, lengths, everything. G-spot, rejuvenation. Look, guys, stay tuned, because I'm sure there is something in this conversation for you. Now you understand why I was curious about this conversation. We started off from Kimbu. That wasn't what we were talking about. This is why I called him here. But look, is it safe?
Sure, it is safe. It sure is safe.
I mean, I know there's a risk to every surgery, you know, but you know, I mean, is this extra riskier, or is just like, you know, normal, going to get your hernia removed and go home?
Well, you know, it's like any surgery. This is elective surgery, and it's not an emergency. So we pretty much have to screen the patient to determine, you know, whether or not they're a candidate for this procedure. And of course, you know, when you go for this type of procedure, you need to check out your doctor. Make sure that they have enough experience, well trained. That's the first thing. Then, when the patient comes to see me, I make sure that I take a good history, make sure there are no medical issues that are red flags, and then I do some lab tests to make sure that we're not going to run into problems. We look at the kidney function, the liver function, and we look at the ability for their blood to clot. We don't want to start doing cutting, and then the blood doesn't clot. So those are the three important areas that we look at. And to make it extra safe, most of my surgery, I don't put anybody to sleep. Okay. Yes, because anesthesia.
So you be slopping out, and they'll be watching the.
What it is that we give the medicine to relax them, so that they can go to sleep and wake up. But when I say I don't put anybody to sleep, it means that they control their own breathing.
Okay.
And during the procedure, I always have a monitor on their finger to check their oxygen saturation. Even when they're sleeping, we know that they're okay. Then we give them medicine for pain, and we give them a cocktail, a mixture of different medicines. And what it does is, one is for pain, one is to constrict the blood vessels so that you don't have excess bleeding, and the other one is essentially to take care of pain whilst the medicine is being delivered. Okay. Wow. So with that cocktail, we're able to numb the area. It's called tumescent anesthesia. Tumescent meaning that it fills up the fat in the skin and blows it up a little bit, and then it begins to be absorbed. We wait for about half an hour before we can start the procedure, so that it hits all the nerve endings. And when that is done, it's safe to do the procedure. So they're awake. You know, they may feel some tugging going on, but they don't feel any pain. You know, which is very, very, very important in this particular case. You know, and then when we have to do certain procedures, we do epidural. Epidural, that is, we give them injection in their spine, and it numbs them from the waist down, actually just above the chest down, and then that becomes the safety factor. Now, in this type of procedures, the other safety concern is what they call fat embolism.
Fat embolism. Now, that's my camera. Look, I'm not going to lift my shirt, but you need to do the pinch and tell me if I need to be sucked out.
Well, you see, when we do the pinch test, you have probably about, I would say, 4 or 5 centimeters of fat. And so this pinch test says that you are a good candidate.
I'm due.
And we can reduce it to something as small as this, maybe 1.5 centimeters, because we still need to keep some fat, you know, under the skin.
No, so I don't need it.
No. So it protects you. That's natural.
Oh, okay.
So that's how we determine. You know, some people have a pinch test as big as that, and you know, that means more work for me.
So I mean, 4 or 5. Am I bad, or am I good, or moderate?
Well, everything is relative.
Is it?
You know, because you know, it's how you perceive yourself. You know, there's some people who will have, you know, maybe 10 or 15 centimeters of fat in the pinch test, and they think they're okay. But everything is relative. You know.
I see.
But typically, the abdominal girth, you know, the size of it really is an indicator of, you know, your cholesterol level and diabetes risk, you know, risk factors, you know. So we try.
What am I hovering at?
Well, we have to do a measurement to determine, you know. Yeah. So anything, you know, greater than 38 centimeters, it's on the high side, you know, for men.
38 centimeters.
38, 40 centimeters.
No, I'm 36.
Inches. No. Inches. I'm sorry. Inches.
36 is fine.
Yeah.
I'm 36.
Yeah,
so
at the umbilicus. 38
just
inches is high on the high side.
I see.
Yeah.
I see. Doc, now we've established it's safe. Now, G-spot rejuvenation. Let's just briefly educate me. What do you do? Move it to a different position, bring it forward? You know, what do we do with it?
Well, we call it G-spot enhancement.
Enhancement.
No, typically, Now, is this content for adults or is it, we have kids?
Yeah, this content, it's 9 p.m.
All right,
it's 9
all right,
p.m.
all right. So the kids are asleep, so
yeah.
we can talk. We can really talk
Yeah.
language. All right. So typically the G-spot is has a location behind the pubic bone. Okay, you enter the vagina and you move up a little bit anteriorly. It's an area called the G-spot, and typically during sexual intercourse, there's just one position that you can directly make contact with the G-spot, which is moving from behind to the front. And so what happens in the G-spot enhancement is we actually introduce a gel under the surface of the G-spot location to create a little bleb or a little bulge.
Push it out a bit.
Exactly. And when that happens, any penetration into the vagina orifice makes contact with the G-spot. So if you haven't had, so there are two types of orgasm. There's clitoral orgasm and G-spot orgasm. So if you haven't had a G-spot orgasm before, you've tried, we cannot make a G-spot orgasm happen. See, because that area there may be a problem there that we can't fix. But if there's no problem there, all we're doing is just making it more accessible. That's really what it is. And folks swear by it. They're really excited when they get it done. This is like a 15-minute procedure we do. We don't have to put you to sleep.
Look, I know you don't do it, but in your field you can talk. I mean, those who go to the extreme where, girls become boys and boys, become girls. Let's start with, boys becoming girls. I mean, you grow boobs, you probably have a snipper and go to the extreme and even have a vagina, created for you. I mean, what is life like? I mean, do you then, what sort of complications have you got, or after that you're okay to live?
Well, sometimes some of these things border on, I'm not saying it's a psychological or mental. It's not a derangement, but it's maybe it's hormonal as well. But I fortunately for me, I don't have folks requesting these things to be done. So I must be honest. I don't have a lot of experience with sex change. But I know that folks come in and they get hormones to get their breast enlarged, and then they go in for certain particular doctors to perform this kind of procedure for them. But that's not my area, unfortunately.
Another thing is vaginal rejuvenation.
Yes.
So what do you do to it then?
Well, vaginal rejuvenation is an umbrella term for people who, remember now, I'm a cosmetic gynecologist.
Cosmetic gynecologist.
Right.
Okay.
So there are certain areas in gynecology that folks want to enhance. You see what I'm saying?
Okay.
They say men are visual, women are oral.
Yeah.
So they want the men to see the stuff so they can get excited about it. So whatever they need to do, if it's the breast they need to shape nicely, sometimes it helps. Not sometimes, a lot of times it helps. If you look at the outside of the vagina, for some women, we call something labia majora, or the external lips. If it loses fat, if it becomes too long, for some people, they think that it's not attractive. Because I'm sure when ladies go around, they look at their friends, you know, in different situations, and they see what their friends have, and they say, I like this, you know, or they look at movies and, you know, things like that. So when the external labia is too long and flappy, we can reduce the size. If it's lost fat, we can actually transfer fat into that area to cover the external orifice to make it very youthful.
Doc,
and attractive.
Before I forget, if you haven't had babies, can you have lipo? If you haven't had a child yet, can you have lipo or tummy tuck?
I wouldn't recommend tummy tuck for someone who's trying to have a baby. But liposuction, you can have liposuction and have a baby. You know, it shouldn't be a problem. You know, yeah, that's really, you know, like, yeah, liposuction. Yeah, you can have liposuction. I've had several people come to me had liposuction.
Even though they haven't, okay,
yeah,
and
they
it
have babies later.
Have babies
so
later.
It doesn't harm anybody at all.
I mean, I knew I won't be able to cover all my curiosity today, but Doc, you come to Ghana, what, 4 times in a year?
Yes.
And then you'll be at the Center for Cosmetic Surgery in Ghana.
Yes.
And what's that?
It's over at Airport Women's Hospital.
Okay.
On Aviation Road before you get to the mosque, you know, and we position ourselves in that environment because we know that women need mommy makeover. You know, after they've had their babies, the bodies, you know, may have gone through changes, and they need rejuvenation of their body, really. So that's the mommy makeover, where if we have to do a breast lift, we do that. If we have to tighten the saggy stomach with abdomen, we do that.
So how do you approach your surgery in Ghana? And so you see them on the first visit and then treat them on the second visit, or because you come 4 times in a year, so I'm wondering how you're able to get your patients, look at them and treat them. How do you schedule it?
Well, I have a patient care coordinator who is based here, and she communicates with the patients, and the patients communicate with me whilst I'm even in the US. And the ones who are serious typically would come to see me for consultation on my visit. If they come in early enough and they don't have any risk factors, I let them do their lab work and we can schedule them for the visit whilst I'm here. If they come too late, we schedule them for the subsequent visit, because remember, there's no emergency here. We just want it to be safe. We just want them to be happy. We don't want any complications, you know. So that's really how I set it up. So they call the number, they make an appointment, and we're able to see them. And if they can be done the same day, usually the fillers, the Botox, we can do the same day. So they come in, we have it in the fridge, you know, and if they decide they want it, we don't have to do any lab work, you know. It's just, you know, we do it for them.
Look, are husbands bringing their wives, or are wives coming in on their own? What's the trend?
Well, that's the tough thing. A lot of times, I tell you what, a lot of times the wives are saying that their husbands don't want them to come. You see what I'm saying? But half the time, the husbands who actually come in with their wives, and you know, they have made the decision together. So it's I would say 60% just rough. 60% of the time, the husbands are coming with their wives, very supportive.
I was about 40% of the time you're scared, because you say, "Oh, Kwasi, let's go and get your tummy down." So you want to say my stomach is big? So you might as well just say, "Oh, you're fine, you're fine."
Well, you know, I mean, it's a discussion, folks. As they become aware of these things, they decide.
How about, sorry, I'm bombarding you all these questions. Silicone implants. I mean, do you do silicone implants?
We do saline and silicone implants. They're safe.
They're safe.
Yeah, they're safe.
Sailing.
Yes, salt water.
Oh.
And then salt water. We put in the it's a silicone shell.
Okay.
We put salt water in it, and then we do implant.
Okay.
Yeah. So they say. They say.
Are we doing that in Ghana? Or?
Yes.
Yeah.
Yes.
Yeah.
We're doing that in Ghana.
I see.
We're doing that in Ghana. Yeah.
Are people able to afford it though?
Well, obviously, the ones who come are able to afford it. Yeah. There are a few people who have to make 2 trips before they are able to make up their mind. But you know, eventually they're able to afford it.
Another one. Can you breastfeed if you've had the implant thing?
Of course. What it is that the implant goes under the muscle.
Okay.
And breastfeeding and the breast milk really comes from the glands.
Okay.
So the gland is on top of the muscle, so it doesn't interfere with production of breast milk at all.
I see.
Yes. So it's safe.
I'm sure the guys at home, thinking, because they all, wondering all these things that, all these things that I'm wondering. What do we get more? Do you get more reduction or more,
I get more lifts.
You get more lifts.
Yeah. The breast is sagging. They want it to point. That's what I get more.
Look, once you put this implant in there, is the milk safe? Is it not going to contaminate? We hear all these stories where, the milk get contaminated. We don't want any saline. We don't want the babies drinking saline.
Saline is salt water. But once the saline leaves the sac of the envelope, then the breast deflates. It's not. But it doesn't. You see, remember, the milk is coming from the glands, and the saline doesn't really get
have any connection.
Yeah.
Doctor, you sound like you enjoy the job. It must be an interesting job.
Well, I enjoy what I do because I try to give people what they're looking for, and when I see the smile on their face, it brings me pleasure. I'm really excited that they like what I do for them.
Folks, Dr. Kwasi Debra, cosmetic surgeon. It must be a really fun job. Get women come up to your office, carve them out, they turn up 2 weeks later, they are much prettier than they turned up before. It must be very, very fulfilling. Doctor, thank you very much for talking to us. And until I come to you next Friday with a different personality, have a wonderful, wonderful weekend. But I have enjoyed this interview. Thank you.